everyone, it's Lexi, and I know some of you know that towards the end of February, if you've watched a couple of my videos, I mentioned that I was having ACL reconstruction surgery done, and a couple of you had some questions about like kind of the procedure and all that, so I decided to make a video. So this is kind of an informative video. This is a revision, so this is the second time I've torn my ACL in this knee, so it may be a little different for everyone, but basically the premise is similar. So I'll kind of just go into background of how I tore it the first time and like how I ended up tearing it again. My family and I went skiing in late January of 2012, and I don't know, I was really excited to go skiing because I thought like my parents have been skiing together since they were 15, so I was like, it's in my blood. But I kept falling, like even trying to get to the ski lift, and then to get to the main hill you have to like go down like a small like little incline, and I kept falling during that, so I ended up crawling to get to the top of the hill essentially. So I should have known then that like this was not for me. I was like, I can toboggan but I can't ski. I don't know, which I'm a disgrace for Canadians, but oh well. So as I was trying to go down the hill, I started to do the splits and I panicked because I was like, this is not gonna end well. So I panicked and quickly try to get my legs back together to normal, but in doing so I ended up crossing my right ski over my left and I fell forward, and right then that created like that pop. And I felt a pop, but I didn't hear it, I think because I had like the snow pants on and like all the ski equipment. So I was basically at the top of the hill, like no joke. I wasn't even 10 feet down the hill, and so like it ended up being a full rupture, and I had that surgery done in February of 2012, and then flash forward to October, like I remember the date, October 27th of 2016, I was playing intramural volleyball with some of the people in my program, and I don't know, I always had issues with this knee even after like physical therapy. Like it always bothered me, so I think it was just a ticking time bomb, and it was just a matter of time, to be quite honest. So I played oozeball like the month before, which is like mud volleyball, and I like had no problem. So I was like, I'm like really excited because I kind of had to retire from volleyball like pretty young. I played till like about grade 11. I had like a couple of like nerve damage issues with my ankle, so I couldn't play at that level. So I was really excited to kind of get back into like intramural. I haven't played court volleyball. Like we'll play it, like we have like a full volleyball court like on our yard, and we always play in the summer, and I had no problem. So I was like, this is the first time I'm kind of getting back onto the court, so I was really excited. And I don't know, like I didn't even make it one full rotation around, and it was not even like 10 minutes, and so the ball came to me, and it kind of, someone like tipped it, so like where I originally was not necessarily like where it was going was not like I was ready to get it, but then someone tipped it, so then I went to go like this, and I planted my right leg down, and I kind of went like this on my one leg while the rest of my right leg stayed planted while the rest of me went this way, and then I kind of fell backwards. And then when I was falling backwards, I felt and heard the pop. Like even the guy next to me, he's like, oh my god, I heard that pop. So right away I knew that I tore it again, just having like been through it before. Like I knew, so my friend took me to the hospital. Like they can't really do anything there anyways, but just to make sure nothing's broken, they did like an x-ray, and there was no problems there. So I was referred to an orthopedic surgeon, and then so I had to go back to an orthopedic surgeon a couple days later, and he had to look at my knee, and he did like the drawer test, and they take your knee and basically like kind of go like this to see if there's an end point. And they had trouble with this the last time when I tore it because it was inconclusive, because my quads and my hamstrings are really tight, so it's hard to kind of get that loose joint. So he wasn't really sure, but he ordered the MRI anyway. And by this point it's mid-November when I get the results, like after the MRI, and they found that it's a full rupture of the ACL again. So I go to school like about 3 hours away from home, like in a different state. So this was like a big thing. Like the doctor that I saw here at school, he was not comfortable with doing the surgery, so I was referred to another one, but I wanted to go back to like home to my original doctor that did the first surgery. So I saw, like, I wanted to get it done over Christmas break, but that just didn't working with like timing and schedules. So I saw him during break to get like the initial assessment and all that. And I ended up having to get a CAT scan as well because they wanted to know if this would be a two-step surgery, because they drill holes into your bone and sometimes like that bone can get damaged, so they would have to do like a bone graft first and then do the revision. But luckily that wasn't an issue. So after that he looked into the MRI a little bit further, and he wasn't really comfortable doing with this surgery again. So he referred me to another doctor that specializes in revisions. So I was able to get that set up. My surgery was February 22nd. So I was like for 4 months basically waiting to get the surgery done. Usually wait about like a month. So it was a bit of a struggle. So because last time I had an allograft, so basically I had the tissue that they used to make my new ACL came from my cadaver, but because it failed within like 4.5 years, they figured that we should try to do an autograft. So they harvested tissue from me. So originally the plan was to do my hamstring tendon, but when I met with the doctor a couple days before the surgery, he said that my holes that they drilled into the bone were a little bit bigger than what they usually are, like what their recommended diameters are, I guess. And so because of that, like, he wanted to use my quadriceps tendon because you can harvest more tissue. So they take out the middle third of the quadriceps tendon to use that as well. So I was a little bit nervous because I do have nerve damage in that area, but this doctor, unlike my first doctor that I had, was really like, he wanted to like, he was like, he knew the effects that this, like, my type of nerve damage can have with healing. So he wanted to do a nerve block, and I didn't have a nerve block done last time. I did, like, because of my nerve damage, I had a nerve block for my hand, and they put it like in your neck. So I was really nervous about that. So on the day of the surgery, we got there around 10:30ish, and they took me in, and I had to do, like, they get you all dressed up in your gown or whatever. I wore like spandex, like volleyball spandex underneath, just because underneath the gown, because I remember last time that's what I did, and there was no way I would be able to get pants on after the surgery because, like, your leg is literally locked in full extension. Like, you wake up and there's like this ginormous brace on you and you're in a lot of pain. And so, like, I made sure I kept that on. I was adamant about that because they said I could keep my underwear on. Actually, they were against that first because the nerve block, they need to kind of get in around that area. But I was adamant to have it on. So they did that. So they first started to give me the IV. And I take after my mom, where it's very hard for them to find the actual and like to get it there. Like, they always have a hard time getting the vein. So I'm there, and then I don't like needles, so like they're digging around trying to get to that vein to get the IV in, and they're poking around, and I'm in a lot, like, it's hurting, and so I'm getting a little teary-eyed. And so then the anesthesiologist comes, and he is talking about giving me the nerve block, and I'm like, I don't think I can do this, like, because they were gonna do a nerve block on my femoral nerve, which covers like basically the front half of your leg, and then the sciatic nerve, which is like the back part of your leg. So then I'll be completely numb. And so I was like, I don't think I can do this. Like, I had a nerve block, like, this is when they're digging the needle in, so it didn't help. And I was like, I don't think I can do that. Like, I had a nerve block before, and like, they didn't sedate me or anything, and I like freaked out during it. But he's like, I don't know. So then he went to go talk to my doctor and just saying, like, you know, I'm really hesitant about this. And then they talked to my parents, but they were able to convince me. So once they got the IV in, they had to like go like higher up my arm. But they did sedate me for it, so I was like more relaxed, because I think like last time, like, I flipped out, like I almost like hopped off the table really, because I just don't like needles, and it's like that. So they did the femoral nerve and then the sciatic nerve, which was fine. And so like right away you lose feeling in that leg. So that was okay. I was a little bit uncooperative with that part, but they were like really good. The doctor had, like the anesthesiologist had really good bedside manner and all that. Like he and his son is actually in the same program I am in, just at a different school. So I thought that was neat because our program, there's only like there's less than a dozen schools that have this program, this master's program. So that was really neat. He was really good. And so my parents came after that just to see me, and they got me all ready, and so they were there for like maybe 5 or 10 minutes before they kind of wheeled me out into the OR. And then so they kind of help you prop you up on the operating table, and then they secure your hands so you're like out like this. You can't really see, but your arms are out. They kind of secure it so I guess you don't fall off. And then I fell asleep. They gave me the anesthesia right away, so that was nice. And then I woke up. I remember because there was a clock and I saw that it was around 12, and I ended up waking up around 5. So the surgery ended up being a lot longer than what the doctor expected, because they found extensive cartilage damage in my knee that needed to be cleaned up, that I probably had prior to when I tore it again. So that ended up being, it's usually like a 2-hour procedure, but ended up being like 3.5. So I woke up and I still could not feel anything in my leg, and you wake up and my leg was fully bandaged, and I had a compression sleeve on both my legs actually, and yeah, and then they had the brace on, and then the orthotist came in just kind of talking about the brace and all that, and I'm in an orthotics and prosthetics program, so it worked out because I was like, yep, I know all this stuff, and I was a little groggy and that. So then my parents, like, they wheeled me out and I came home, and I think the nerve block did end up being very beneficial because I couldn't feel anything. It just felt like I had 100 pounds of dead weight because I couldn't like move my leg at all. Like there's one point where my leg was like dragging on the floor, and I had completely had no idea because I couldn't feel it. So that was nice. And they give you like this machine basically that has like a pad that you can like wrap around your leg with like a tensor bandage, and it connects to like this little pump, like this cooler essentially, that you can put, we just freeze like water bottles and put them in there with water so you get like that cold flow, which was really helpful, and also some pain medication as well. So it for the first like night it wasn't bad at all. It's just uncomfortable because you're in your brace, like especially the first couple days, because I was so numb. I didn't want to take the first day, like the first night, I didn't want to take my brace off at night because like I couldn't feel anything. So I was in my brace, and then the kind of numbness wore off about like 24 hours later that following day, and then that's when I started to feel a lot of pain and discomfort. It's like a sharp pain, and I kind of had some circulatory problems in my toes, like my toes were frozen, so that was like a big thing, just trying to do that. So yeah, and so yeah, the first couple days were rough, and I just took the pain meds, so it made me really sleepy, but it wasn't too bad at all. I had physio on that Monday, so at Wednesday was my surgery, and then I had my first physio appointment on Monday, and that was when I first got to see kind of the extensiveness of the surgery, because last time I had 4 very small arthroscopic incisions, and then this time I literally have like a 3-inch incision going halfway up my leg, and then like another one that's like 1.5 inches. So I was really shocked to kind of see that, and just because he made it sound like it'd be like a small incision for the quadriceps tendon, but it's literally like, so it was like, it looks like a shark bite, basically how they stitch it up. Like it's gonna be a nasty scar. So I'll show you a picture here of like what it looks like. Yeah, so it looks pretty bad, and I had it like cleaned up the next day. I went back to the doctor and they cleaned it up and like redid all the bandages. So yeah, so physio for basically for me, because I did use the quadriceps tendon, like you lose kind of function of it, like I can't do a leg lift at all. So physio right now has been centered around getting that quad to fire again and just building up that strength, and then also getting more knee flexion, and that's basically what it is, and just kind of building it up from there. I'm in my 2nd week of physio. So I had to go back to school. So I had 2 physio appointments through the hospital that I had the surgery done, and then I am started at a new place closer to school. But the premise of it is the same. Usually physio for this type of extensive surgery is about 5 to 6 months. That's because I did have the quadriceps tendon, and it does prolong kind of like the rehabilitation, because a lot of it is centered around the quadricep getting the fired. So I'm still on crutches. I'm semi weight bearing, and I'll show you like my brace and all that in a little bit, and like my scar. You probably saw it there, and it's gross, but yeah, so that's basically the biggest thing. The doctor said this usually takes about a year, maybe a little longer, because of the quadriceps tendon, and that's basically what it was. The first time I had it, I was in physio for maybe 3 months there. And then, so you are in, like, I'll show you this brace here. So you're in this like full brace that they can gradually increase your knee flexion and that you can have during walking. Right now, because I don't have that quad firing, right now I'm in full extension, so I can't move my knee at all when I'm in the brace. I have to wear the brace all the time when I'm weight bearing. It's nice now I take it off to sleep and it doesn't bother me. So yeah, that's the next thing. And then after that, you kind of graduate after you get like full mobility for between like the maybe like 4 months to 8 months or 9 months. Like I wore my last brace for a really long time. It's a smaller one that's more compact. But yeah, so I'll show you kind of like what my knee looks like now. It's pretty swollen still, and that was an issue that I had last time, was just getting the swelling down, and I just came back from my physio, so it's probably really swollen still, but I'll show you kind of what it looks like in the brace and everything. So yeah, let's just go hop down to that. So like I just have a pant leg on. Usually I wear shorts, but we have like patient models coming into school, so I have to look somewhat professional. So you basically have this brace that covers the span, that it goes just below your hips and goes just above your ankle. So I'll just take it off real quick so you can see. Yeah, so you just buckle it up here. It does slide down. That's the biggest issue with these knee orthoses. So I just have this sleeve on that they gave me. It kind of helps protect the knee and provides some compression, but also keeps the incisions dry. So I'll just roll this down for you. So you can see it's still quite swollen. I'll show you my other knee. Yeah, it's like a little bowling ball on my knee. So I have 2 incisions up here. I have like an older one up here, but these are 2 new incisions. So you can see the quadriceps tendon that they took out. Like, it's pretty hefty as well. I have another small incision here, and then this one as well. This one has some drainage still, so I took the band-aids off just to clean them, and I left them on so I can show you, but I have to put like band-aids back on it. Biggest thing is that these do get itchy, so I recommend polysporin on them. And yeah, so I have another incision here as well that goes down. That's about 1.5 inches, so it's not as bad as the one that's up here. But yeah, and then you can see that there is a lot of bruising kind of going down my thigh, and then I also have some that go up here as well. So you can see it's still very swollen. Yeah, I'll kind of show you a different angle of it as well, so you can kind of see from above. Yeah, so here you can kind of see the differences between the two. So you can see like the extensive bruising and all that. Like, it is very itchy here in the 2 incisions here as well. So you can kind of see the differences. I don't have nice looking knees to begin with, but so this doesn't help, but it's still quite swollen, and there's extensive bruising along here. So yeah. And also it kind of worked out too because of the nerve block and the swelling, and they say this happens with the quadriceps because they do like cut through so much, is that I have no feeling here at all. So like within the skin, and essentially I still feel pain, but like, yeah, like I don't feel like any of this. So it does work out because I do have the hypersensitivity with my nerve damage. But yeah, so you can see bruising, and then you can see kind of the swelling that you do get. You kind of get puffing in between where the straps are on your brace. So yeah, it's not, it looks worse than it actually is. Like, I'm gonna have like a gnarly scar here, so it looks like, you know, but you're part of an elite people who tear your ACL. So yeah, it's a nasty scar, but you'll have a good story to tell. I just have to come up with a better story as to why these scars are here, because mine's pretty, I basically tipped over. So in conclusion, ACL tears are actually probably the most common tears that occur basically to athletes or to anyone. So if you are going to have this surgery, it's not as bad as it seems. Sure, it's inconvenient to be on crutches. I've been on crutches 4 months prior to my surgery, and probably for another month or so. So it is a bit challenging, but it's like totally fine, and everyone will be saying what a tough cookie you are, so that's always nice to have that recognition. So yeah, basically it's not as bad as it seems. It could be worse, to be quite honest. It is convenient. It is painful, but you need to get through the pain and kind of stretch out that ligament again. So if you have any questions about like physical therapy and all that, and so I probably will do like a follow-up as well, so you can kind of get like, see how I am maybe in like a month or so. So yeah, if you have any questions, please let me know, leave them down below. And yeah, thank you so much for watching, and I will see you guys next time. Bye guys.